Hello and welcome to the Community Voice. I'm Fara Sax. The Dr. J.T. McDonald Foundation is the driving force behind better care in Miami-Dade County, investing in care where it's most needed. This initiative supports everything from groundbreaking medical research and partnerships with the University of Miami. Its impact is very far-reaching. During this interview, we will meet 4 key leaders in our community affiliated with the foundation and UHealth. John Edward Smith joins us now, and he is its managing director. Thank you for joining me today, John.
Good morning, Farah. Thank you.
So
pleasure to be here.
It's a pleasure to have you. Tell me a little bit about the foundation and its mission and its purpose, how it got started, so that our audience can really get to know what is being done in our local community and through, we will learn later, of UHealth.
I appreciate the opportunity. The foundation was established at the foundation of Doctors Hospital back in the late 1940s, and it was named after one of the founders of Doctors Hospital, Dr. John Templer McDonald. The foundation then became a grant-making organization when Doctors Hospital was sold in 1992. And then the board decided to make it a grant-making organization. And since then, over the last 33 years, the foundation has contributed some $53 million to the community in advancement of medical issues.
And talk a little bit about its beginnings and where you've been and where you're going to, and where what you see in the future for the foundation, because you have a wonderful partnership or a collaboration with UHealth.
We have 3 signature programs that are involved at the University of Miami that have been established by the foundation. The Human Genetics Department at UHealth, which is now, I believe, the number 2 genetics department in the United States. We established a nanotechnology institute at the university, and our principal signature program now, the School Health Initiative, which we started back in the year 2000.
And this is in 2007, the Children's Trust became part of this engagement. And let's talk a little bit about that and that how that presents in the foundation and what you're doing to connect the community with its people.
Correct. The Children's Trust is established by a vote of a tax of the community, and back in 2002, I believe, and it has grown over the course of the years. It is, as I said, a tax-supported initiative. The foundation had already established a school health program, so the foundation and the Children's Trust sort of wedded with respect for the program at the university, and has delightfully been able to expand the program. The Children's Trust now is supporting our effort to the tune of some $4 million, and has allowed the school health program to advance from 9 schools this year to last year to 36 going forward. And this is an initiative that has just reaching thousands of kids. It's fantastic.
Why is it so important? Reaching the schools in underserved communities. Talk about why it's important for our community.
Well, I think, when we have healthy children, we have, better results in school. We're addressing needs that are not addressed otherwise. We're dealing with an underserved population, and I think it's entirely the way that we need to be addressing health issues in our community with their young kids. I mean, this is they grow up learning to manage health, their own health situation. And I'm sure Dr. Gwynn and her compatriots, Dr. Sukkar and Dr. Pulgron, will be able to address some of those issues much better than I can, for sure. They're in the front line.
Dr. Lisa Gwynn, who is the Medical Director, School of Health Initiative, and Program Director for the last 9 years. Well, that's a lot to say. Welcome.
Thank you.
So let's talk about it. In addition to the direct care, the initiative provides education on vaping, substance abuse, or substance use, I should say, which can lead to abuse, and wellness. Why is this beyond the clinic approach essential for students today?
So in addition to the primary care services that we do provide in our clinics, one of the most important things that we've found is really engaging in our student community. So being involved with what the kids are doing, whether it's on the athletic field, whether it's in the classroom, whether it's through school events. And in that way, we're able to get to know our students. The students get to know us. They're less intimidated by coming into the clinic. So we have a very strong engagement component to what we do. In addition, we offer other enhancements. We have a Student Champions program in which we have students actually engage in getting the word out about our clinic, and also we help to build their self-esteem and help them to find a path for their future. So again, we have all kinds of enhancements of engagement. In addition, we've found that there are a lot of issues that need to be addressed in which we can help with our expertise, one of which is vaping. So a lot of students, that's sort of the up-and-coming public health crisis that we have with students, especially in high school, middle schools and high schools. And there's not a lot of options for treatment. And so we've identified this as a problem in our schools, and through the hard work of Dr. Sukkar, she has been able to create a program, an intervention program, and we partner with our school administrations to try and find better solutions for these students to help them quit.
So we're talking about, you mentioned clinic. Is it that you go to the schools of the underserved and you set up a clinic inside the school where the student population come to you? How does that work? Let's talk about how that happens.
Sure. So our clinics are co-located within the schools. There's clinical space that's already built out. And we basically have our team stationary there every day. We have some clinics that are just health suites that have a nurse in them, and they provide basic first aid, they administer medications, and so forth. We also have 5 primary care centers, so they are full-fledged pediatrics offices with doctors. We have mental health professionals in there as well. We have social workers. So all of our team is able to provide medical care, mental health services, and of course connecting them to social services when needed. So again, these enhancements have happened through partnerships with not only the Children's Trust and the school district, but most importantly with the Dr. John T. McDonald Foundation, because without their support, we wouldn't be able to bring all of these enhancements into the clinics and schools.
How long have you been in the schools with these clinics?
So the Department of Pediatrics has been, they spearheaded the program, or took it over, I should say, 9 years ago. So we felt that our department was able to bring in much more services through actively engaging pediatricians, psychologists, all specializing in pediatric care.
And talk about the results of having this, right in the middle of the school population to help these students. What is that? How has that changed these students' lives? And even their families, knowing that they have these resources available to them right where their children are every day.
Well, families that we serve are really sort of shocked that this is available to them. Remember, these are all underserved populations who have challenges with access to care already. So the thought that they actually have doctors within their child's school is really remarkable. And those parents that do learn about our services definitely take advantage of it. So I would say that's what is the most surprising to our families. Families that need our help, in addition, we also have outreach specialists that interview the families if they need Medicaid or if they need other social services outside. So it goes beyond just the medical care and the mental health care. In addition, it helps families that have food insecurity and, again, access to health insurance.
And how do the mobile health units improve the access to care and, I guess, reduce the barriers for students and families in these underserved communities?
So the University of Miami has had a mobile clinic program for 33 years now.
That's a long time.
Yes, it is. And we actually have 2 units. Thankfully, through the expansion project, we've been able to dedicate one of those units to our school health initiative. So we actually take the mobile units to some of these schools that don't have the enhanced primary care services, and we offer those services to those schools as well. So we offer immunizations, we offer sports physicals for athletes, as well as EKGs, which is part of the new mandate for athletes in Florida. So the mobile unit just brings the care even more closer to the students, especially those that don't have access.
Thank you so much, Dr. Gwynn.
Thank you.
Dr. Fara Sukkar is an MD. She's also the lead pediatrician.
Yes.
That's a mouthful there, right?
Thank you.
You deal with kids.
I sure do.
You like kids?
I love them. They're the best.
This year, the initiative that we're talking about expanded to 36 schools.
Yes.
Wow, and more than 28,000 students. That's a big expansion.
It is.
Why is it important, and what community does the program primarily serve? We talked about the underprivileged, but let's get more in detail.
Absolutely. So thank you. I'm very happy to be the lead pediatrician for our school health initiative, in large part because of exactly who we serve. So our initiative was very grateful to be able to expand this year with the assistance of the Children's Trust and the John T. McDonald Foundation, such that, as you mentioned, we went from 9 to 36. And that was the first time we had expanded in the program's about 20-year almost history now. And what our expansion has done is really open up, in addition to our original 9 schools, all of the feeder schools for our clinics. For example, now we'll have the elementary, middle, and high school unit that leads to a primary care center of ours. So thankfully, we've been able to really expand what services we're able to offer to even more students in the central Miami-Dade region, which is very historic in terms of the neighborhoods of Little Havana, Alapata, and Overtown and beyond. And as we moved the expansion, we were also able to expand our reach up north. So we even have into Little Haiti, into North Miami Beach. So we've really been able to expand those services to a larger population of ages and students, of course, now that it's over 28,000.
When you started, how long have you been working with the...
Well, so actually, I started, this is just the finish of my first year with the...
And you're still smiling. God bless.
Yes, it was about a few months into me starting that this opportunity presented itself. And we had a great conversation as a team, and we said, should we apply to do this massive expansion? And it was a unanimous yes, because I think what we are able to offer these students is so fulfilling on a personal and
Tell me a little bit about that for yourself.
Oh my goodness. Well, I am the child of immigrants, and I went to public school in Florida. And I think that for years, as I have trained at the University of Miami for a few years with my medical school and my residency, I saw so many families that look a lot like my family. Families that struggled when they got here, families that didn't speak English, families that didn't have resources like this. And so I think my family and in a lot of ways myself in these children. And I'm just so grateful that with the opportunities that were allotted to me, I'm now able to give back to these kinds of families to help them get care that they didn't realize that they could get for free without insurance, without transportation, with social barriers to care. So it really means a lot.
And the program now offers really a comprehensive medical services, including, I'm going to read here, acute care,
yes,
chronic disease management, vaccinations. We won't go into that detail, but the detail of vaccinations is really important, and
yes,
sports physicals. Which services are I guess, the most in demand, and why do you think that is?
Absolutely. Well, our program, you can think about it in kind of two ways, as Dr. Gwynn was mentioning. We have traditional health suites. So in those schools, it's the more traditional. You have a nurse who's there to help with the students day to day. Kids spend 8 hours a day at school, so a third of their lives are happening at school. So when they need anything, we are there to help support them in that immediate, whether it's their chronic medications because they have diabetes or they have asthma and they're not feeling well, or maybe they need a Band-Aid. We do all of that care every day in all of our schools. In addition, we have the comprehensive services. So we have 4, soon to be 5, flagship, if you will, where we have full medical care, pediatricians, nurse practitioners, specialists who come and do these expanded services. So full well-child checks and sports physicals. The truth is, by volume, our program has seen just in 6 months over 15,000 nursing-only visits, and then an additional almost 7,000 medical visits. In those medical visits, right now, definitely sports physicals. These are families, especially with the expansion of the requirements for the sports physical to require an EKG. A lot of our families struggle to get an EKG even if you have a regular pediatrician, because not most pediatricians necessarily have that machinery in their office or have a cardiologist available to read those EKGs. With our program, we have free EKGs connected with the UHealth cardiologists who read them and tell us what is actually concerning for these students and who needs follow-up. So I would say sports physicals right now from the medical side is definitely our highest need.
Last question. For you, as a pediatrician, as a woman, what has been the most important moment for you in this journey in the last year?
Wow. I think that for me, when you set out to become a pediatrician, you dream of being able to be there for people, of being able to be there for students and their families long term. And I think that with this year, looking back now at the expansion, this is the dream, right, of continuity, to be able to really follow a child through their elementary, middle, and I see mainly a lot of high schoolers, which is where our comprehensive are, to watch them grow, even in this last year, to be able to go now to their graduations, to their homecoming, to their prom, to their football games, to become that kind of presence in their lives, in a way that I didn't anticipate I would be able to be as a pediatrician. I think it's been really special.
Thank you.
Thank you.
Dr. Elizabeth Pulgron, thank you so much for joining me. You are a mental health director and associate professor of clinical pediatrics at the University of Miller School of Medicine. That's a lot to say.
It is a lot to say.
Wow. And we're going to talk about mental health. It's really important for our community. Been through so much as a local community, as a global community. This initiative has initially expanded into mental health services and experienced a high volume of crisis encounters. What trends are you seeing in the school with mental health, and how the program is responding to what they're encountering in the schools?
Excellent question. I think most of us are becoming aware of the importance of mental health. And the foundation was actually one of the first to invest in mental health early on. Of course, since then, there's been so many things that have happened between school violence and COVID. We've all realized how important it is to invest in youth mental health. And right now, we focus, of course, on any crisis. There's a lot of anxiety. There's a lot of depression in our youth. My goal long-term is to focus on prevention. So through programs like our school health initiative, we invest in children's mental health care at the elementary school level, through middle school, through high school. So it might get to the point where it is not necessarily a crisis, where the first time that a child has an encounter with a mental health provider, a psychologist, a counselor, a social worker, whoever it might be, if they grow up with those safe people around to be able to express themselves, to notice when they're starting to have a problem, we would have such a difference in the number of crises that we have today.
What is the anxiety about? What's going on? I mean, my generation, your generation, we dealt with it within ourselves. We didn't have a safe place to go. So what we worked out, if we were lucky, is a mentor a parent, a family friend, a peer? What is going on now in that they're coming forward and talking about this anxiety? Where is it coming from?
Well, I want to acknowledge that the stigma is decreasing. And I think that's so important because you're right. This is not a new concept. Mental health issues have always existed. But we're getting to the point where even youth are recognizing, oh, maybe I need a little extra help. Maybe I need a professional to speak to. Coaches, teachers, parents, families, they're all going to continue to support our youth. But sometimes we need a little bit more direction, some evidence base to address these issues before they become larger issues. And again, I think that's one of the assets of this program is that you have professionals in school rather than having to go out. It is very hard to get a mental health appointment in the community. Yet our youth have the opportunity throughout the school day to potentially come downstairs into clinic and see a mental health provider. And if we can start early, it will make such an important impact in the number of cases that we see later on.
So do the children come down and say, hey, I'm feeling X, Y, and Z? Or is it the observation from who they're dealing with directly in the classroom? Or is it a parent that comes to you? How does that come forth?
Excellent question. A little bit of all of the above, I'll be honest. We do have students that actually come down to clinic. Can I see the person that you have to talk to when you need to talk to someone?
But isn't that great that they're able to find words and to know that the feelings are not feeling comfortable?
Absolutely. Absolutely. I think that just shows the progress that we've made. Do we still have work to be done? Yes, of course. We also get a lot of referrals from teachers. Teachers spend so much time with students, so they kind of observe, they might notice. We have parents coming into clinic. I think my kid needs some help. I'm not able to address their needs myself. I need some assistance. We have principals who refer. We have youth that refer their friends. Those are always very interesting because if I have a student who's willing to refer their friend, then I know I'm doing excellent work.
That's a really safe relationship, a sacred relationship to have that reciprocity.
Absolutely. And we're building a culture of health within our school. Right? So we're looking at both mental health and medical health and recognizing that we are an entire body and sometimes we need to attune to one piece or another, but really it is the whole person that we're trying to help.
And also this initiative contributes to research, conference presentations and training. How does this academic component strengthen the broadest sense of school health, let's just say?
Absolutely. We are very invested in training our residents at the University of Miami, our fellows, our practicum students. We are very much an interdisciplinary clinic. So nursing, social work, psychiatry, all of the disciplines that come through. And that's part of the university's mission, but also an opportunity for future healthcare workers to understand the importance of working in the community. They have that experience one-on-one during their training. We have other types of research studies. We were talking about anxiety a little bit ago. We did a large-scale study on testing the effectiveness of groups on anxiety and depression in our schools. Not everybody can make it out to the university or to some subspecialty clinic, but most kids can get to school. So those training opportunities, those research studies, and then sharing that knowledge back with the larger academic community. We go to national conferences, international talks, consistently sharing what we do, and everyone is impressed because this model doesn't exist everywhere.
So what happens next after a child? How many clinicians or practitioners are working in the schools? What happens once the information is given? Is it given back to the guardian parent? Is it the feedback given to the child? How does that relationship, that tender relationship of secrecy, as I say, move forward so that the child keeps opening up and the parents are satisfied with that?
Yes. So psychology is unique in that we have a very delicate conversation in the beginning about confidentiality. Because you're right, that's absolutely important. You're not going to necessarily share everything to some person. And being in the school, is this going to get back to my teacher? Is this going to get to my friends? So there is a balance there between providing healthcare and also trying to increase accesses to services. So we're very clear with our students. This is a clinic. There is a consent that is signed. We follow the same regulations as the university. Of course, if there's an emergency, there can be some sort of rupture to confidentiality, and we have to do what needs to be done according to the laws. But for the most part, it stays within the session. And the parents know that, the child knows that, and of course, we reach out to parents as needed.
And what role do these community partners, as we say, play in this program's success? And how have other organizations across Miami-Dade supported what you're doing? Because it really does take a village.
That's exactly what I was going to say. I was going to say it takes a village.
I know
we're not doing this
it's
alone.
mental health right now, right? We are talking.
I'm so proud. Absolutely.
Can I be part of your team?
Yes, I would love that. Come over. That would be great. So it takes, this is a group effort by all means. So, of course, we have the foundation who's been investing in us for so many years. The Children's Trust, which is one of our primary funders. We collaborate with the Florida Department of Health, Miami-Dade County Public Schools, of course. But in addition to the key large players, we work with the community. We cannot take everybody and continue to see them within school, so we refer out to our community partners locally, depending on where the school is, back to the university. It does take a village. You're absolutely right, and we're fortunate to have a wonderful community around us.
Last question. Mm-hmm. What wakes you up in the morning? What gets you out of bed? What gets you excited for the work that you do?
I think this is such meaningful work. To your point earlier, we didn't have this necessarily when I was growing up in school, maybe when many of the viewers were growing up. It is such a unique opportunity to invest in children's health early on, both their physical health and their mental health. And I want to highlight, this is high-quality healthcare, right? We're coming from the University of Miami, top-notch research and academic center, and we are able to offer this to all of the children in our schools. And that, for me, is an opportunity and a blessing, and I'm very, very grateful.
Thank you so much, Doctor. Appreciate it.
So we want to thank all of our supporters of school health. School health, what we've learned, is so incredibly important to the health and well-being of students. We know that when children maximize their health, they also maximize their learning potential, which leads to a much brighter future for children. So for the community at large, we are here for you. We have mobile units. We have clinics in our schools. We hope that everyone can take advantage of our wonderful program.
And I want to thank my guests today for joining me and educating me on the initiative, the foundation, and all the work that you do with such heart and soul. And it's really been my privilege. So thank you for all the sweat equity that you're putting into our community, our children, and making it really a great place to be. For more information, the information is on the bottom, and feel free to get involved, learn more, and I want to thank you for joining me again. I'm Fara Sax. Until next time, take care of yourselves and each other. Have a great day.